And joining me now in the studio is Dr. Ricardo Cigarroa. He is a doctor of internal medicine and cardiologist. Dr. Cigarroa, thanks for joining us here.
Thank you very much for inviting me.
Appreciate it. Oh, first of all, thank you. And I know you're on the front lines there as a physician, seeing everything that's going on related to to COVID-19. But there's just a lot of information, and there's a lot of information that maybe is not getting to people. And you were showing me some numbers there, and some of the stats are a little sobering.
Yes. So I think that, as in all problems that descend upon us, we should always look back a little bit in history and see if we can glean something that might help us. And if you look at the great plagues that have come upon this world, the plague of Justinian in 541 AD, 25 million people died. The Black Plague in 1347, 50 million people died. They say that at that time the living were just burying the dead. And in the plague of Italy and the plague of London, an enormous amount of deaths. What was common in all of those plagues? What was common is that it was a contagion, virus or bacteria that had no treatment and that was highly contagious. And how were those plagues all solved? They were not solved by the medical community. They were not solved by hospitals. They were solved by quarantine. Quarantine either as a result of such tremendous death that people were isolated from each other, or quarantine that resulted from martial law, in essence. But that's how those plagues were solved.
And that's the best thing, that is the best advice anybody can give right now, is just stay out of the way of people.
Yes. So COVID-19, a highly, highly contagious virus. COVID-19, no treatment. There are certain things that seem to be helpful, but really no treatment. And what I'd like to do is, let's take a model and base it on our community of Laredo. So I don't know if there's a slide here that I'd like to see, but if you look at our population of 275,000 people, 10% of us are expected to contract this virus. That's 27,500 people. Of those 27,500 people, 80% will recover. It's a cold or a flu at home. 14% will get severe symptoms and require hospitalization. That's nearly 4,000 people. Our community has 500 hospital beds. 5% of those will require intensive care unit. That's 1,400 people. We have 70 ICU beds. So do the math. How are we going to solve this? Usually we think our doctors, the best health care in the world, our hospitals, they will take care of us. We cannot. The volume is going to be tremendous if we don't pay attention to history. And history here tells us the solution is quarantine.
And the sobering number there is 2.3% of those cases will die.
Result in death.
So that, if my math is right, amounts to about 500 or so people, roughly. The numbers you have there in terms of hospital beds, and again, you talk about just don't even be part of that 10%. If you can just stay away and be part of the 90%, you're not going to have to worry about any of those numbers at all.
We're talking about these numbers over the next 4 weeks, not over a year. So how can we handle that volume? We can't. New York has shown you that we can't. Boston has shown you, Michigan now, and Texas has a big possibility of being the next New York.
Yeah. The University of Texas came out with some studies showing that the number in the border between Laredo, McAllen, and Brownsville could hit 350,000 people. Do you think that that is something, because of the geographic region of where we stand, that those numbers could actually become a reality?
I very much think that they can become a reality. And if you take it a step further, our sister city, Nuevo Laredo, really has such a dense population and so much poverty and such little access to health care that I wouldn't be surprised if the numbers are worse than that.
You know, you're talking about the numbers. We get the graphic out from the city every day as terms of those numbers, but you were saying that that may not be necessarily a complete picture of what is happening out in the community.
So in talking to a lot of my fellow physicians, healthcare providers, nurse practitioners that are taking care of patients in the front lines, I estimate that we probably have at least 2,000 patients with COVID at present. And you'll take a step back and say, how's that possible? Our health department says that we have 100, and we've tested 500.
Right.
Well, the issue is, one, very little access to the exams. Two, they're expensive. And three, our recommendation is going to be the same. So our recommendation, if you have a cold or flu, the best thing to do is assume you have COVID. Isolate yourself. Quarantine yourself. And the reality of it is, whether you have symptoms, you don't have symptoms, whether you're sick, you're not sick, stay home.
Yeah. You know, graphic shows % of people will recover just,
Yes.
will just fight it and recover without any major issue. Again, getting back to what you were saying is just the not being out there at all plays a huge role in this completely.
It is the only solution.
Now, what do I need to look out for? What is my first? What do I need to look out first to kind of begin to wonder, begin to suspect maybe I do have this? I mean, you know, we're kind of getting into
Sure.
allergy season also, and so you're also going to have that kind of variable at play on people. But what do I need to look out for if I'm somebody who feels that I have symptoms that I normally would not have? At what point do I suspect I may have this, and at what point do I seek
Medical
help?
attention. So let's go through the symptoms, and I think it's important to talk about what's frequent and what's not, because it's confusing. I think if you have fever and a dry cough, those you get in 70 to 80% of patients with COVID. Fatigue is a major symptom also. And fatigue is a fatigue that you've never experienced before. You really feel exhausted. Phlegm you see, muscle aches you see. You often hear diarrhea. Diarrhea is only in 3% of the cases. What we find in 1 out of 3 cases is loss of smell and taste. So those are the important things. Fever, dry cough, assume you have COVID. And really, there's no reason in the era of a pandemic and the timing of a pandemic, there's no reason to distinguish, is this my sinuses or is this COVID? Make the assumption that it's COVID and stay home.
City just came out with the mask order.
Yes.
Is that something that you feel will help reduce the numbers or keep things from getting way out of control?
So I think it's a very important aspect, but remember, wearing masks doesn't protect you so much as the person who's infected isn't going to infect others. So there's a difference there. Remember, 10% of people with the virus have no symptoms, especially the first 4 days.
Yeah.
And so they're out contaminating everybody.
Based on what you've seen, what's happening in China, looks like things settled down there about 3 or 4 months. Do you feel that we may be kind of along the same timeline as what was seen in China?
I think what we will see is our peak the last week of April, first week of May. So I think we're going to have to be quarantined all of April and probably part of May until we start seeing that curve drop.
Based on what you've also seen, Doctor, how quickly, in your experience from being a medical professional for so many years, how quickly is a vaccine and some type of medicine likely to take before it becomes widely available on the market?
So I don't see it helping us during this pandemic. I think that we're going to have a lot of pain, a lot of tragedy. I think every family will be affected. I do believe we'll have a vaccine by next year, so that when this comes around next time, we'll be in much better shape. But I don't think we're going to have anything wonderful in the next 2 months with respect to a vaccine. Yeah. And that's why the solution is not going to be medicines. It's not exposing yourself.
Yeah. You were talking about many people are going to be asymptomatic. They're not going to show anything, but those individuals can still pass it on to other people. Your advice, if you're asymptomatic, I mean, I guess you would know. How would you be able, if you're asymptomatic, how would you be able to know that?
There's nothing to do other than to follow the recommendations of wearing the mask, wash your hands frequently, don't touch your eyes, your face, and avoid touching other people.
Because those really are the dangerous ones, right? The ones who don't know they have it and aren't showing it.
But that's why the recommendation is everybody should wear a mask.
Yeah.
And everybody should be quarantined. So I don't think you should wait for symptoms. I think we all need to do it. Whether you test positive, whether you test negative, if you have symptoms, whether you don't have symptoms, it's not important.
Yeah.
If we want to solve this for our community, everybody has to do their part. And I know it's very difficult to stay home for 6 weeks. But let me tell you, it's much more difficult to look into the eyes of your daughter or your son that have the illness and you know they're going to die. There is no cursing.
There are people who have had this or who have gone through it say it is a horrible feeling. Have you treated any who has COVID, and are the symptoms really as bad as people there?
So in the 5% who are critically ill, it's terrible. And the virus just macerates the lungs and turns them into liquid, and there's nothing we can do to help them. And because we have ventilators here in town, sometimes the agony can be protracted. But critically ill, just imagine yourself drowning, and you know you're drowning. And we know we don't have any treatment for them other than supportive.
And the people who are more at risk are obviously the elderly, we've talked about that, but then other underlying conditions would be what?
So anyone who's immunocompromised, who's had a transplant, who has any kind of cancer, who's on any treatments and chemotherapy, but don't be fooled by that. young, healthy people. And we've had 40-year-olds, 50-year-olds, 60-year-olds intubated in the ICU. And like you just said today, we have some very young people. So don't take them young, so I don't have to be as weak. We've seen young people die across the country.
Any last bits of advice for people who are watching us at home?
I think the last bit of advice is to think for yourself. Look at your children. Ask yourself, is quarantine worth their lives? And it is. And another way to look at this is, what would you do if there was a sniper across the street on top of the roof? Would you allow your child, your son, your daughter, your parents to walk out of that house? I don't think you would. And the virus is everywhere. It's on top of every house. So please, think for yourself, listen to the guidelines, and remember, all healthcare providers here, all the nurses will stay with you throughout all of this. And it will pass, and it will be relegated to medical history. But we need your help.
Right. One last question I forgot to ask is can somebody get it just from air exposure if they're quarantined at home, or if they're practicing social distancing and staying home? Is the virus floating around in the air where someone can inhale and contract it that way?
So, two ways. Aerosol, but usually it's 6 feet from the person who has it, so that we have the 6-foot rule. And then it stays on surfaces. So cell phones, iPads, it stays there for approximately 3 to 6 hours. Cardboard could be up to 72 hours. So you'll see a lot of people with their Amazon packages leaving them outside for 3 days. I don't know if that needs to be done or not, but it does stay on the surfaces up to 3 days.
At this point, better to err on the side of caution.
Always.
Dr. Cigarroa, thank you so much for joining us. Very enlightening. Appreciate the info. Thanks for being here.
I appreciate it.